I said, like, it's embarrassing to cry, but it's not embarrassing to cry. Ta-da! We're gonna unpack what the doctor explained to me. Good morning. Oh my god, I look like crap. Clean the camera. I don't know whether it's clean or not, but okay. I woke up early. Actually, I'm still sleepy. My alarm was at 8 a.m. but I snoozed it like twice and then I changed my alarm to like 9 a.m. because I took like cough medication last night and I don't know, somehow it knocked me out. Usually it doesn't. I don't know why I'm still not fully recovered. I finished my antibiotics and I don't know. But anyway, the reason I woke up early is because in about 5 minutes, I actually have a call with my therapist. I don't know what to call it. This is my first call. It's my first time ever seeking therapy. I don't know. I'm even anxious to have a therapy session, which is like, that speaks volume over my anxiety. Like, I was so anxious. Like, I was already thinking of ways on how to get out of this call, when this call is supposed to help me, but because of anxiety, I just feel like I don't want to talk to a stranger. I don't want to know. I don't know. So it is true that getting help is the first step, because getting help is not easy. It's not easy. I can already feel myself tearing up because like my body is so used to being stressed and being anxious and being depressed that the thought of healing myself, my body just doesn't want it. Like, no, you know. But yeah, we'll see how the session goes. And after the session, I will need to get ready because I have my follow-up dermatologist appointment. Can you see my eyes welling up already? And I look like crap, but ignore me looking like crap. I'll tell you guys how it went. I just finished my consultation. I've been holding in my tears. Look at my... Yeah. So, I think it was a good one. Dude, I'm wanting to cry. Dude, processing the trauma. It's not easy, by the way. So it's... Oh my god. I fucking hate it when people record themselves when they cry. But I just needed to share. Because it's my first therapy. I didn't cry, by the way. During the session, I didn't cry. I was holding it in because I'm so used to holding things in. Oh my god, I look so ugly. But yeah, get your therapy session, guys. You need to work on some things. Fuck, this is so embarrassing. But yeah. Okay, I am ready to go to my dermatologist appointment. Hold on, let me get my bag. So I'm rocking my new Beyond the Vines XS dumpling bag that I got from Singapore. And I haven't worn a vest in a while. I miss wearing vests. Like, it's my signature look. And then my Carhartt t-shirt and the cotton on pants that I got from Singapore as well. I don't know why I've been buying cotton on in Singapore. But when I got it, I had to get it because I thought my period was done, but apparently it's not done, so I stained my pants. So I needed to get like a new one because I didn't bring enough pants. So that's the reason why I bought cotton on in fucking Singapore with the exchange rate of 3.5. Yeah, but they had a 30% off, so I only paid like 180 ringgit technically. But yeah, dumb decision. But anyway, I needed the pants, okay? But yeah, look at my dumpling bag. It's so cute. I'm looking awesome and cute today after crying to you earlier. By the way, I need to say this. I know I said like it's embarrassing to cry, but it's not embarrassing to cry, okay? You can cry. It's just that sometimes maybe you don't have to record it. But I wanted to record it. Why am I over justifying myself? I don't have to justify myself. Okay, bye. See you. Oh my god, I am late to my appointment by about 10 minutes. Wish me luck. Dude, I never understand like this kind of lift numbers. Oh, so confusing. Can you see these? Oh, the sun. So yeah, I did chemical peel. It's called milk peel, and yeah, I took off my makeup and it took about 1 hour. It's gonna be 5 days downtime. Girl, I don't know if it looks any different, but according to her it did. I don't know. You'll see. Hello, good morning. Today is 24th March 2024. It's a Sunday. Oh! Anyway, today is 24th March 2024. It's a Sunday and it's about 9:30 a.m. I'm heading to the clinic where I got my full body medical checkup last week, and I am collecting the report for my blood test. And I'll be doing my urine test and also my pap smear. I am on my downtime from my chemical peel yesterday, so I can't be wearing makeup, but I have lip tint on. But yeah, so I'm supposed to like moisturize a lot and make sure that I reapply sunscreen. So yeah, bare face. And because I washed my hair yesterday, but somehow it's greasy, I don't know why, so I decided to put a hat on. And I'm actually wearing a dress for the pap smear. I don't know if they're still gonna make me take off all my clothes, but I'm wearing a dress for easy access. And of course, Miso with her meowing whenever I'm here trying to vlog. Also, yesterday, oh my god, when I got back, I lost my keys. I found out that I lost my keys. It was so stupid. And I found out that I lost 2 of my copied keys. How is that even possible? But I lost my keys and I couldn't find it anywhere. I don't know where I lost it. I have no idea where I lost it. This never happened to me for the past years. I never lose keys. Like, that never happened to me. Very odd. But anyways, thankfully, my house owner lived just above me. Yeah, the husband, I always like just deal with him, but he was out of town. Thank God the wife is here. Can you imagine if they were both out of town? I won't be able to get into my house, and oh my god. But thankfully she was there, so she helped me because they have a spare key. Oh, so dramatic. Anyways, I'll see you guys later. Bye. Outfit of the day, because I am lazy and I can't wear makeup, and I am doing my second round of medical checkup because I didn't get to do pap smear and urine tests, and I'm also heading to get my report. Ta-da! With my with my matching socks. So I just got my report. I'll talk more about it when I get home. But for now, we're gonna have Kahyung because I wanna have Kahyung. Hello, I am back home from picking up my report, the result from my full body medical checkup last week. We're gonna unpack what the doctor explained to me. It's gonna be triggering for some people maybe, so trigger warning. I'm gonna be talking about my diagnosis and some diseases that may trigger people. So first of all, I got a referral letter to actually see like a specialist. So she wrote me a referral letter because the lesion on my left breast is worth looking into. I need to do a bit of research, like which hospital I want to go to, or like which surgeon I want to go to, and then I need to book an appointment, and then I need to submit it for a GL letter is redundant. it's GL, because we don't know what is that left lesion on my breast is, so she couldn't really advise. But based on my test result, it's not cancer. Okay, so basically I do have fatty liver, and the fatty liver it came from having too much sugar in my blood. So meaning I consume excessive sugar, which I am pretty aware of, and I try to actually cut it down. But I guess, I mean, if you have a family history of diabetes, then you are more prone to be insulin resistant. So yeah, I was diagnosed with diabetes. It's not that bad in a sense that in terms of the percentage, not that high, not to the point that I need medication. I do need to make some lifestyle changes in terms of like my pancreas, the ultrasound, basically like my kidney, my liver and stuff like that. Normal, thankfully. However, I knew this, by the way, because my parents told me this, but my parents are thalassemia carrier, and there are different types, of course. I think they have thalassemia minor, like, yeah, something like that. But basically, there's like thalassemia minor, and then there's thalassemia major. Thalassemia major is where you will have complications, like quite severe complications. I do have cousins who, like a few cousins from my dad's side that has thalassemia major, and most of them do not live past 30. That's the average age that a thalassemia major patient would live up to. I may not know 100%. I'm not super educated on this subject. Yeah, so basically I have that, as in like I'm also a carrier, and technically because both of my parents are carrier, there's a 25% chance that their offsprings will develop thalassemia major. So I have 3 siblings, we do the math, but it may not develop like early on, but it might lead to that in the later age. So just because the first 30 years of your life you don't have it does not mean that it can't develop into thalassemia major down the line, which if I want to look deeper into it, I need to do a more in-depth test to see which type I am and whether there is a risk for that. So I mean, I've known that I grew up anemic. Like, yeah, I've actually been like bedridden for a month. When I was 15, I lost like 15 kg from that because of my anemia. It is also because maybe I was thalassemic. I don't know, I'm not sure, but I was anemic basically. So guys, before you get married and have kids, please get tested with all of these things. Just be a responsible human being. Don't subject your future offsprings to this kind of risk, like health risk. Okay? Get tested, make better decisions as future parents. Okay? This is very, very important because it's so selfish of you to still get married and have kids if both of you are thalassemia carrier with like alpha genes. I'm not sure, but the fact that there's 25% chance that your offspring could develop thalassemia major, it could have been avoided. Be responsible, test yourself on this. Okay, don't be selfish. And also, one thing that I was so thankful for, I don't know, not thankful, but trigger warning, I am suicidal. I've had suicidal thoughts in the past. But when she told me, you are now 31 years old, if you have thalassemia, you wouldn't have lived past this age. You wouldn't have lived past 18. And I was like, you know how like, okay, for people who have had suicidal thoughts, when you have it, you are very stuck in that moment of wanting things to end. But when you're stabilized and you're being told these things, in a sense that you might actually not even have a choice whether you want to live or not. If your body's working against you, if your genetics are working against you, you might not have a choice that you want to live or not want to live. So I was just like damn. 31-year-old me would not have been able to listen to this diagnosis. If I really had it, I would have just died at 18. So that did something to me. So yeah, get tested, guys. So basically, I'm diabetic, right? And my glucose is at 5.6. It needs to be lesser than 6.1 mmol. I don't know how to read that, but yeah, then above that it's like diabetic, as in my glucose is 5.6, however my whole blood is at 6.1, so I'm right at this, like the cutoff. 6.1, lesser than 6.1 is considered non-diabetic, but I'm right smack center 6.1, so I am diabetic. So this is something reversible. I know that in the past, when my mom told me she was diagnosed with diabetes, she actually cried because she thought her life was over. I forgot at what age she was diagnosed, but I think hers was quite severe because she had to be on medication. Whereas for me, the doctor said that I do not have to be on medication, but I do have to make some lifestyle changes, and that is to cut out sugar completely from my life, like added sugar. I mean, I can't help it if I eat out and they add sugar, but of course I need to work towards not exposing myself towards those kind of diet. I don't know, I knew that at one point of my life I would have diabetes because my mom has it, and also because of I have a sweet tooth, so I know that I need to reduce it. This is just a wake-up call to validate the fact that I definitely need to stop over-consuming sugar. Like, this is it. I'm diabetic, for God's sake. So I'm just digesting the report. So basically, just because you're diagnosed, there are different types of diabetes. I'm guessing, I'm not sure, is this type 2? This is reversible with diet, as long as I do not consume excessive sugar or cut out sugar completely from my diet. Then I shall be able to reverse it, per se. Not reverse it to the point that I would then be able to eat anything I want or everything I want afterwards. To reverse it in a sense that it will no longer be detected as diabetes, like diabetic blood glucose level from my blood test. I can only reverse it that way, so that it's not detected when I do blood tests. I'm not detected as diabetic. So that's the only good thing, I guess. But technically, I'm still diabetic. You know what I mean? In a sense that my insulin would still be resistant to digest sugar, but it may not be able to spike it so high that it's present in my blood test. So yeah, just because it's reversible with diet does not mean that I can eat whatever the fuck I want, because my body just doesn't digest glucose that well as other people who are not diabetic. Okay, so it just says here impaired fasting glucose, like impaired glucose tolerance. Gotta cut those sugars, honey. Apparently, my stomach is quite good. I do not have the bacteria that most people have that causes unhealthy gut. My gut is healthy, so I do consume what do you call that? Yeah, like supplements that are good for your gut. Yeah, I do consume that for a long time, and I do like eating fermented food, so I think that helps. Yeah, and also the fatty liver is because of sugar, and I do have a little bit of lesion in my gallbladder, but apparently it's nothing to be concerned of according to the doctor, and I can actually reverse it if I increase my activity, my daily activity, which I have been doing. I've been trying to walk as much as I could. I've been doing that quite consistently since end of December last year, so I think that actually really helped a lot. If I did this perhaps middle of last year or maybe just January, I think the test will be, the result will be very, very different. But because I did it after 3 months of making changes to my diet and my lifestyle, I think this is okay. Like, yeah, I was expecting worse. My ECG is normal. It's great. Yeah, just the breast thing that I have to look into. Okay, yeah, guys, get tested. Get fucking tested. It's better if you know now. It really is. So that it doesn't jeopardize your future potential life. Prevention is better, of course, but finding it in the early stages is even more important. The best time to do it is always now. It's not tomorrow. It's not next week. It's not when I got back from my travel. It's not when I changed job. It's now. You gotta test now. So next week I'm gonna go back to the clinic because I did my urine test and my pap smear. So I'm just gonna get the result then. Take care of your health. Get checked. Just take care of yourself mentally, physically. The world does not end just because you are diagnosed with anything. And 31 is young, but it is also the age where a lot of things started to manifest physically. So you better just get checked. Okay. See you next week. I'm traveling next week. So see you. Bye.